My honest review of Dr. Michael Ye at UCLA and thyroid surgery performed by him. This video, I'm going to break it up into what happened before the surgery, the consultation leading up to the surgery, what happened during the surgery, and then what happened after the surgery. For those of you watching this in Spanish, si hablas español, hay subtítulos en español, si tocas en YouTube. There are captions in Spanish, you can tap it on YouTube. So let me get started with my honest review of Michael Ye at UCLA. I went to Michael Ye for a small thyroid nodule, and he did a surgery, and it didn't go well. During my description here, I'm going to cite a number of publications and some research, and even some podcasts. So I'm going to list those in the description. Just so you know, those aren't my opinions. They're research by the medical community. So let me get started. Let me tell you a little bit about my case. I went to the dentist. They did a touch on my neck. She said, I think you have a little bump there. Now, since this happened to me, they no longer allow dentists to do that kind of screening. I've been meaning to make this video for a long time, but I don't know what happened. Every time I sat down to do it, no words would come out. And I think it's because there's so much regret and so much pain that is associated with the experience with Dr. Ye at UCLA. So let me get started. After the dental appointment, they said, go get a biopsy and see if it's cancer. And the biopsy came back indeterminate. And a doctor in Arizona, he suggested, let's remove your thyroid and check if that nodule is benign or malignant. I did not do that. I ended up having family in Los Angeles. They suggested I go to UCLA. I ended up in Michael Ye's office, who performed the surgery. Leading up to the surgery, he did another biopsy that came back and said, in fact, the thyroid cells are malignant, so let's take out your thyroid. You know, I think when you go through a diagnosis of thyroid cancer, it's so scary to hear the word cancer. But what's important, there's a lot of literature now that says certain kinds of cancer, prostate, thyroid, that when you are told it's cancer, as a doctor, do not tell the patient that directly. Be sure to preface it. Put a lot of attention into thyroid cancer is different than most because no one dies from it, meaning papillary thyroid cancer, which they told me I have, the death rate is 0.0001%. There's a Finnish study that looked at cadavers, and those cadavers died from something else, heart attacks, old age, whatever. But when they checked the thyroid, almost half of them actually had thyroid cancer, but they didn't die from it. And there's another doctor in Kobe, Japan. He does what you call watch and wait, where you're diagnosed with thyroid cancer, but they don't touch it. He has over 3,000 patients in this study over 30 years. None of them have died from their malignant thyroid nodule. He simply observes them and sees if the cancer gets more serious or progresses or not. And if it doesn't, he leaves it alone. But when I asked Mike Ye, it was the day before the surgery, I'll never forget, I was driving from Arizona to LA, and part of my family had breast cancer. My sister, she was saying, you gotta go do this surgery, save your life. My mother, on the other hand, who's very diligent, she researched Mike Ye, UCLA, said don't do it. They're using this as an industry, as a business. You don't need it. Go to Sloan Kettering, Michael Tuttle. Think about this thing called, but I wasn't hearing it. All I was thinking was cancer. I got Michael Ye on the phone. I said, Dr. Ye, do I need to do the surgery? Have you ever had somebody opt out? And his tone got dire. He said, yeah, one lady opted out. I said, what happened to her? He goes, I don't know. In other words, she died, right? He didn't say she died, but it scared the heck out of me. I kept driving. The next day I go up into UCLA, get the surgery, and it didn't go well. He cut my vocal cord. He cut a nerve that goes to my shoulder. He did a lot of cutting. So if you see the image on the screen right now, those are all the staples he put in my neck. Now, skilled surgeons, really good ones, they don't do staples. Michael Ye scattered those all over my neck. So I still have all this metal here, all this tightness. Because he cut the vocal cord, I have a vocal cord implant now, but it's hard to breathe. So you notice there's a thing called VO2 max, where you get oxygen in. When they do a vocal cord implant, which meant another surgery, it blocks half of your windpipe. You don't get as much oxygen. They're finding that VO2 max is the #1 indicator for longevity, for a good long life. If you're not getting all that oxygen into your body, you're gonna live less long and less quality. And for someone who is like me, who's active, an athlete, I enjoy physical fitness. I can't run now, really. I can't, because I can't get all the air in. And another outcome of this, sometimes I'll be drinking and just choke. Kind of embarrassing when you're sitting at the table with people. And then sometimes wake up in the middle of the night, just cannot breathe, right? Those are some of the physical outcomes of what Michael Ye did to me. But some of the mental, when you lose your thyroid, you end up with some brain fog. Your body's never just right. A little bit of lightheadedness, forgetfulness, that happens. And there's the emotional side. So, once you're told you have cancer, once you do a thyroidectomy, this takes a toll on the psyche. And it never feels good to be labeled that guy with cancer. I would much rather have been told you just have this thing called a cancer. You don't have to do a surgery, leave it. A lot of people have it. That's what I tell people now when I meet them. And I think it saved a lot of people from going through the same experience as me, where they opted to not have the surgery and they're doing just fine. And I'm sure there's some of you watching who were told you had a malignant thyroid nodule and you opted to not have surgery. So that's what happened during my surgery. What happened after? I called UCLA, I called the CEO of UCLA, I called Michael Ye. Everybody was not responsive. I called their patient advocacy group. They put me on the line with someone who I think was formerly working at Target. Nothing against people that work at Target, but they're probably not going to have the background to talk about medicine. And this guy collected my info and never went anywhere. Michael Ye never apologized. CEO of UCLA never did anything. As a matter of fact, I ended up posting on Yelp a review about what happened to me. And I'm going to show you on the screen right now, the nurse who was in my procedure, her name was Ann Long. Because I was critical of Mike Ye, she fired back and called me a bunch of names, called me a scammer, I'm looking to sue people. But that was Ann Long. It ended up getting reported to HIPAA. They got a letter from HIPAA, which I'll show on the screen right now, that they were at risk of violation. But again, nothing ever came of it. And now what I noticed with Mike Ye, and I'll get into this in the next video because it's a whole nother thing, but it's about fake Google reviews, censored reviews on areas like Thika, censored reviews and monitored reviews on platforms that are supposed to be open source, and you're able to post a review and let other patients see it so you can help them. But what we're seeing now is what you call reputation management by Mike Ye. So they go on there and monitor, they put fake reviews on Google Maps. I'm going to share that on the next video. But before I exit on this video, if you're diagnosed with thyroid cancer, for sure, do this. Make sure you get a doctor who does not only think that surgery is his financial livelihood and is going to rush you into surgery out of his or her own self-interest. Make sure you get a doctor that's thinking about you and thinking about quality of life, and they do exist. They do exist. After the experience with Mike Ye, I started this podcast called Dr. Thyroid. I'm interviewed over 100 of the best doctors around the world about this topic. And it's really what kind of lit the spark of resentment. Yeah, I think it's okay to have resentment. People say, let go, forgive. No, I'm not going to forgive this one, Mike Ye. But I interviewed, let me start with a doctor in Japan. I didn't name any names. I just said, this is what happened during my surgery. What do you think of that doctor? He nodded. He goes, oh no, that surgeon's unskilled and shouldn't be practicing. He should not be hurting patients like this. And then I presented it to one of the top surgeons in the world in Tennessee. He's done surgeries for even singers. Explained to him what happened. I said, should have this happened? He goes, by all means, no. If it's an experienced surgeon, no. Plus, he goes, I wouldn't have done a surgery on you. And his response was echoed, of course, by the doctor in Japan that said also, we wouldn't have had to do a surgery on you, just leave it alone. It's a slow Thyroid cancer, papillary, is very slow moving. He goes, you probably had it for years. You have no symptoms. You're fine. You're healthy. Leave it alone. If it progresses, we'll do something about it. As a matter of fact, the doctor in Japan, who's now recognized, he was honored by endocrine surgeons with the most honorary recognition this year. He says a lot of times that thyroid nodules sometimes shrink on its own. Maybe the one good outcome of this is I now have this podcast, Dr. Thyroid. If you're watching this video, it's on the Dr. Thyroid YouTube channel. There's all these resources now where I've interviewed a lot of doctors, and you can now avoid thyroid surgery. There's other means now. You can watch and wait. You can do what they call ablation, and it zaps the nodule and makes it disappear, even cancer. I'm gonna get into that in the next video. I just wanna make this video what it is, what the title was, my honest review of Dr. Michael Ye, UCLA, and my experience with the thyroidectomy in his hands. I'm gonna cut this video over for now. You can hit the link in this video that comes up right now that goes to the next video about censored reviews, fake reviews, and what to do if you want to avoid thyroid surgery if you have a thyroid nodule or thyroid cancer. I'm Philip James, everyone, by the way. See you guys.